Um, Good morning, everybody. I'm very pleased to be here to talk to you today. It's my first experience doing one of these, so let's see how this goes. My name is Chris Pearce. I am a practicing clinician here in Victoria. I actually practice in both general practice and emergency medicine. I have an academic background in what we call e-health, which is data, if you like, big data in general practice. And I am a board member of Asthma Australia. So that's the reason I've been asked here to come and talk to you on the title of the new norm. And I think that's because, in part because of the various roles that I have both an understanding of what it's like on both sides of the fence in terms of general practice and specialists, but also with the data work. I've done a lot of work at the moment about all of the changes that are happening at the moment with the clinical world and how we deliver care in this environment. I like it as the title of this is the new norm. And in part of that's because we actually don't know what normal is going to be. We've sort of divided in our own heads the current period to there was a time of uncertainty, which is that period a couple of months ago when we didn't know if we were going into lockdown, if we were going into this, schools, all that sort of stuff. That was uncertainty. Then we had the time of spread, and we're in fact just coming off that time, really, which is the time when we had all of the, we were having 100 new cases a day and so forth. And that was the time at which we thought, things were going to get really ugly. And the reality is it hasn't, which is great. And as we come off that, we're going to have a period what I'm calling that the time of consequences, because we've implemented a whole lot of changes in a hurry because we needed to, which is excellent. But we're just beginning to understand what some of the potential consequences of all those changes are going to be. And they are, they're everything. They're social, they're economic, they're clinical, all sorts of stuff. So there's going to be a whole lot of things as we emerge from all of this that we're going to need to consider. I think realistically, in the clinical world, the biggest change has been, it has been to general practice. And many of you may well have experienced this. The hospital sectors had a lot of warning, had a lot of time to think about it, and has implemented a whole lot of planning and stages and so forth, informed by overseas experience. General practice came into it and sort of went, well, there's a lot of stuff that's going to happen, and we need some help. And the government went, yeah, absolutely. You can use a telephone tomorrow. Off you go. Okay, that's a little bit complicated. And that's about what happened. We started off with the ability that we could ring patients who we thought had COVID. But then it became apparent the more we did the social distancing that we actually needed to completely restructure how primary care interacted with patients. Now it goes by this umbrella name Telehealth, and in reality, Telehealth is a term that has been around for years, and it just in many ways just means delivering healthcare by means other than actually having a patient in the same room. But more traditionally, people have assumed that it's meant video consultations. And a lot of the work that's been around the country over the years has been about video work. And we know that particularly, obviously, rural areas, it's been used quite a bit. things like dermatology, ear, nose and throat, lots of programs around to deliver virtual care, if you like, using video and a mixture of other things. But when we opened the door to this, the government just said, well, we can now offer a rebate for anything other than a face-to-face consultation. And they offered rebates for telephone and for what they call telehealth and what we actually understand as video consultations. And so now most GPs are using the telephone. We've just done the figures on 1,000 practices in our area, which is Victoria and New South Wales. And telehealth is now about half. So it's 50-50 telehealth type consultations to face-to-face consultations in primary care. So most of that is telephone. So all of a sudden now your GP is ringing you up on the phone and talking to you. Now, there's a couple of interesting sort of consequences to that, not just the use of the telephone, but at the same time, we've had these messages around people saying, well, you know, don't go outside. So particularly if you're elderly, and they're the people who have chronic and complex disease by and large, but also people with, you know, chronic disease of any sort at any age. We've been saying to people, don't go outside, don't mix, don't go out in groups and all that sort of stuff. And that combined with obviously a not unreasonable perception that healthcare facilities, clinics and hospitals are the places you are more likely to get exposed to people with COVID, has meant people are actually been staying away from healthcare in general. And that's not a good thing. And we are quite concerned about some of the consequences of people who are deciding to up their self-care so that they don't have to go to the doctor. I've seen in my general practice a couple of people who've been struggling at home with their conditions, and by the time I actually see them, you know, it's like, no, just go to hospital, you know. And they go, but, you know, hospital's got COVID. And it's like, yeah, well, in fact, no. You know, we're now at the downward side. You hear all the stuff around the cases dropping. The hospitals have actually done a lot of work to streamline their processes. So hospitals are very safe places to go these days. As realistically, our general practices are not unusual scenario. I mean, all general practice deal with it differently, but in most places now, you know, your first contact with your practice is you know, before the time with the sorry, I just got distracted, with the practice by telephone. Now the practice will offer you a telehealth consult, which may mean the GP rings you to talk about your condition. Or if it's relevant, then they may well say, look, you just need to come in to see us. And it's really important to understand that that's okay. And it's not because, you know, clinics are now, you know, dangerous places to be. In fact, it's quite the reverse. So you will often these days, if you need to go and see your GP in person, you drive into the car park, you ring the practice and you say, I'm here. And then, you know, the GP will ring you or come out and say, come on, in you come. And you walk past an empty waiting room, wave at the reception staff that normally you'd stand up at the counter with and just go straight into the room. The GP will be wearing a mask, maybe a gown, just depends. And, you know, you get your consultation and that's fine. The other thing I think I wanted to talk about is we're using the telephone a lot. And I think it's important to realize that the telephone is useful but very limited. And one of the things that I think as you get your heads around, telehealth, dealing with your GPs, you also need to think about how's the best way for my GP to actually look at me. And I'm sorry, classically in this setting, I get a lot of information from just eyeballing your child with an asthma attack. The not just the rate of breathing, but how they're doing it, how active they are. Are their lips dry? A whole lot of stuff. So I don't actually, yes, to be able to put a stethoscope on the chest is helpful, but I get a lot of information just by eyeballing you, and that's a lot more information that's on the phone. So I can only talk about my experience per se, but I use a lot of FaceTime, which is the Apple thing, because I'm an Apple device person. And any child that I see who's sick, if they've got FaceTime, I'm really reassured, because I can just, hit the FaceTime button and see them. Now, not everyone has Apple devices, and I'm just using something that, in the last couple of weeks, that's easy for me and for the patient. But each of you, I would encourage to think about what's the best way you can do it yourselves. So your GP knows, for instance, that you've got an Apple device, or that you have some other means by which to do this. Adding the visual element to it. I know that there's a lot of concern about, telehealth and privacy. And look, I think privacy is something that's important. On the other hand, I don't ever want privacy to actually put us more at risk than less at risk. And I think that, for instance, doing a straight video chat over FaceTime or over whatever the WhatsApp or whatever method you use, they're usually encrypted, but they generally are encrypted, so it can't be intercepted on the way. You don't keep a record of it. It's not set on a server. So I don't think you need to be concerned about that. Telephone, obviously the same. It's, in fact, the 4G network, or the old 3G network, certainly was unencrypted, and you could hijack that if you wanted to. That's not the case with the current technologies. But on the other hand, you've got to think about what it is that you're talking about and how better it is to benefit your health. I think there's another future bit that I think is worth talking about, because one of the things that I'm sure you're in the same boat. Certainly at the clinical end, we've been crying out for these sort of changes for years. I'm sure you've all had the experience of, you go and see your GP with your asthma, and the GP says, look, yeah, it's okay. I think we're pretty under control. We'll just do this. Come back tomorrow just to make sure everything's all right. Now, coming back tomorrow means, well, if you've got the kids, it's putting the kids in the car, the sick child and the other child into the car seat, and coming out and sitting, and God, I'm running a bit behind, all that sort of stuff. Versus now, and I've done it, and it's great, because I just ring you up. How's it going? Oh yeah, much better. Good, we can all relax. That's fine. You haven't had to leave the house. I'm now running to time because that didn't take very long. All that sort of stuff. And we need the government's released all these item numbers, but they've said only until September, only until September 30. We're just going to see. And I don't think, I don't think that we want to go back to where we were before, back to the, well, if we need to check on this and, I'm going to have a Medicare rebate for it and all that sort of stuff, well, you're going to have to get in the car and stick the kid in the pusher and, all that sort of stuff to come in versus just the phone. That's not ideal. The other bit that this is driven that's going to be very interesting, I think, in the next couple of months is that it's driven a lot of change in terms of electronic transfer of X, let's say. And the first thing is going to be prescriptions. In this day and age, you're exchanging information with your bank electronically and your lawyer electronically, and your prescription's still got to be a piece of paper. Well, no, that's changed as of 2 weeks ago. We need to do some software stuff, but prescriptions will become electronic and electronically transferable, and you can get them electronically. And I think the same, there's the driver for the same thing, so that there's going to be a lot more electronic test ordering, and I think the things so that you can get access to your own information, to your referral letter can be sent electronically to you and the specialist, and you can then control what happens to it. Of course, if any of you've got a My Health record, that's been a very interesting journey. I've been involved in that over the years, but that's going to, that's going to be now an important source of information for you in terms of your test results that you can get for yourself, and you can always ask for them, personally. But I've been in the habit of when the test result comes through, printing it off, sticking it in post, and sending it off. Well, like there's only 2 or 3 postal deliveries a week these days. Things take forever. So I think that this isn't the new norm at the moment. This is just a weird norm. And at the end of it, we're going to have to look at what's better. What's better? How can we make our lives easier, but still deliver the clinical care that we can? So the take-home message is don't neglect the care that you would normally get. If you've got an issue, you can ring your GP, and these days you can ring them and they can even ring you back and talk to you about it. Don't be afraid of hospitals. If you feel like you're really sick, call an ambulance. If you call an ambulance, they come. The ambulance officers now come and they've got the mask on and stuff like that. But they're still wearing the blue stuff unless you ring them up and sound like you've got COVID-19, you've come from overseas, you've got a fever, you've got a cough. Then they put on all of the hazmat suit, but mostly it's just your standard ambulance officer with a white mask and so forth. So just behave as you've normally done, and contact your GP. That's the short answer to everything. It's all good. Schools, I think there's a lot of discussion, certainly here in Victoria, because we seem to be arguing with the federal government about schools. And it's a very interesting thing, because the more we look at the data that's coming out of places like Europe and so forth, that we can't find that children are a specific and significant problem, both in terms of getting the disease and at spreading it. So at the moment in Switzerland, parts of Switzerland now are allowing grandchildren to hug their grandparents on the basis of that sort of data. But I think that the Victorian government's approach is a bit different to the other states. it highlights the problem to do with public health versus individual concern. Public health is exactly that. It's about the population versus the healthcare of your individual. And I think schools are the classic example. So the states have gone and said, look, we think that students should stay at home, and but if you have trouble, you're a healthcare worker, you know, your job is important, whatever, schools will stay open for you. And people can argue about the detail of that, but the detail is that in that population versus personal. So at a population level, you know, you're talking, we're reducing the level of contact so that, you know, only 1 in 10,000 will get COVID-19 versus 200 in 10,000, if you like. If you have significant concerns about your children getting COVID, well, then they should stay home. If you have significant personal concerns about getting COVID, then you should stay home. But everything in life in some ways is a balance, and this is the balance that you have to draw. And part of it also is, you know, going to school and going to public transport, you know, public transport things is, you know, to be honest, going on a train at the moment, certainly in Victoria, is fine. You know, I've watched the trains go past and there's, you know, 7 carriages and 10 people. It's easy to create social distancing when you're the person who's electing to use it because everyone else is staying away. The more people who say, oh yes, but public transport is okay because it's deserted, then you get the spread-on effect of being not deserted. Life's a very interesting balance at times. And having talked a lot about, you know, asthma and the consequences of the sort of current circumstance, I think one of the interesting things that we're seeing in the data that I mentioned before that we're following is mental health issues are just rising. We need to, there was an initial spurt of, in that time of uncertainty, of anxiety. That makes sense. When life is uncertain, people are more likely to be anxious. But as time has gone on and we've spent more time in this isolation, we're seeing a lot more mental health issues pop up. And there's all sorts of aspects to that. There's, you know, all of a sudden you're living in the family home with 5 or 6 people you haven't spent a lot of time with in the last 10 years. You are in a state of anxiety every time you go to the supermarket. If you are, you know, distant from family. I have, you know, grandchildren who are not in Melbourne, and I haven't seen them for 4 months. There's lots of things that are driving a lot of mental health issues, and the reality is that that's one of the things, in fact, that the telehealth is really good for. We've known for actually 15 to 20 years that actually doing some mental health stuff, counselling and all that sort of stuff over the phone is just as effective in many ways as seeing people face to face for, you know, specific problems and short periods of time. And it really highlights the fact that there's a lot of resources that are appearing, many of which have been there for a while but just not well used, available for people. Like Asthma Australia's got all sorts of stuff available for asthma on its website, and there's a lot of mental health things that are available too. If you just look at, Google the various things, there's a thing called Mood Gym from the Australian National University, I hope. And the University of New South Wales has some really good sites where you can do assessments and even some stuff to manage your anxiety over there. Look, I sort of have spoken a little bit about technology and telehealth and video conferencing, which is actually, I think, the pointy end of quite a bit of ways in which we can use the digital world, if you like, to help us. Can you imagine doing this, in the Spanish flu epidemic without the internet? It's just defies belief. The fact that I am here doing this talk so that we can help you in what you do, I think it is just a bonus. There's the government's information app, COVID-19, which just is a really good source of what's happening and where. There is, of course, the COVID Safe app, and I don't. Each of you can make your individual decisions around the privacy aspects of that, if you like. I've certainly got it and downloaded it, but I think it's a very interesting use of phone technology around handling and managing a pandemic such as this. And I think it's going to be very interesting to look at it 4 months down the track and see if, see what effect it's had and what effect it hasn't had. And I'm certainly reassured by the fact that I can then just delete it, and all the data will go with it. With telehealth, I think also there'll be a follow-up, as I've said, with a lot of electronic transfer of information, even just, to be honest, straight emailing of basic information, I think is an underutilized resource. At the practice level, that's because the practice software doesn't actually build it in very well, and I think that will change very shortly. Yeah, look, and I think, I think that the final message really has to be, although on the surface it looks like there's enormous change happening in the clinical space, in many ways the changes are relatively superficial. It really is that, for your care, it should be business as usual. You should, have all of your self-monitoring stuff in place, and that's always the best thing, to monitor your own care. If you feel like you're coming unstuck, then it is your usual processes. Follow your plan, contact your GP, who may talk to you, may video you, or may get you to come in, and that's all fine. If you need to call an ambulance, and they'll still come, and they won't look like they're aliens. At the hospital, gotta say, same deal. As I said, I work in an emergency department, and we've been sufficiently successful in the social distancing and the flattening the curve that in the emergency department, I'm sort of like, can I have some work, please? We were gearing up for rooms full of people who couldn't breathe, and they just haven't turned up. So I'd really have no concerns about going to a hospital at this point. In fact, you won't be sitting for 4 hours or 8 hours waiting for something to happen. You'll be in. It's good. So that's business as usual, and then just be prepared for some more significant changes or more persistence of some of the good bits. As I said, like the telephone follows up, the electronic transfer of information like prescriptions and so forth into the future. And I think that, well, I know because I'm on the board that Asthma Australia is really on top of all of this sort of stuff. And I can see on the chat thing there that all the resources they've got are flowing through. And I really encourage you to have a look at those and take it from there. Otherwise, 30 minutes, and I think I've talked enough. And I thank you all for listening. If you have any more questions, email Asthma Australia.